clutch assembly.
3 discluders are provided to fit on top of the clutch, as can be seen in the photograph. To size the clutch, a mandibular model of the patient is needed. The operator needs to note where the distal of the second premolar is and take steps to cut the plastic clutch to this position. Each patient is a little bit different, and once cut, the next process is to add some blue periphery wax to the edges so that it isn't sharp to the patient's tissues. Use a burr to trim the clutch, make it a little bit smoother. Any device, high speed or slow speed, works well for cutting and trimming. However, a Brasler acrylic saw works best, even though it is not demonstrated here. Place blue periphery wax around the borders to protect the tissue. This wax also provides a key element of an isthmus over the central incisors. This will make it easier to separate the clutch from the patient's teeth once the procedure has been completed. It is now the time to place one of these 3 discluders on top of the clutch, finding the shortest one that allows clearance in protrusive movements. After selection, the clutch clamp and cross rod are inserted into the process and tightened. The tightening of the screws tightens the plastic clutch to hold the discluder firmly in place. This assembly is then placed in the patient's mouth, pushing the clutch down onto the teeth, making a deep indent into the blue periphery wax where the incisors are.
Next, quick-set plaster like Whitmix Greystone, Kerr No. 2 plaster, or Snapstone is used to secure the clutch assembly to the patient's mandibular teeth.
This requires 2 operators at this stage. It is necessary to have one person in front of the patient so that the clutch horizon can be lined up with the eyes, and the operator holding the clutch needs to position the bar parallel to the forehead when looking over the top of the patient's head. When the plaster starts to set up, an assistant needs to be cleaning the excess plaster from the clutch. It is important not to have anything above the discluder that will interfere with protrusive movement. After the clutch is secure, the side arms can be attached to it.